They share the same superstar ingredient but serve two very different purposes. Wegovy versus Ozempic, which one really delivers? On the left, Ozempic, designed for diabetes management with weight loss benefits. And on the right, Wegovy, a specialized treatment built specifically for weight loss. Let's skip the buzzwords and get to the real stuff. Each category earns points, and at the end you'll see exactly who comes out on top. The result might not be what you expect. Okay, so here's a quick mind map of what we're gonna cover. Monthly cost, maximum dosage, average weight loss, primary FDA approval, injection format, active ingredient, side effects profile, and who each one's best for. Seriously, by the end, you'll know way more than the average person at your next brunch. So first up, let's talk wallet pain, the monthly cost. Ozempic comes out swinging right away. Its list price is around $997 a month. Still not cheap, but here's a little sigh of relief. It's often covered if you have insurance for diabetes, which definitely helps. Plus, doctors prescribe it for diabetes, not just weight loss, so getting coverage is a bit more straightforward. On the other hand, Wegovy is, it's expensive. We're talking about $1,349 a month by the list price. And since a lot of plans don't cover weight loss meds, you might be paying that whole amount out of pocket. Sure, it's FDA approved for weight management, but if price is your breaking point, Ozempic is the winner here. Next, let's pump up the numbers, maximum dosage. With Ozempic, the most you get is a 2 mg weekly dose, which is definitely enough for helping with blood sugar and a bit of weight loss. But if you're all in on dropping pounds, Wegovy kinda flexes here. You can go up to 2.4 mg per week, which means more appetite suppression, more I'm actually full feelings, plus a little more flexibility to tailor the dose. Of course, the higher you go, the riskier things can get with side effects, but if you want the max, Wegovy takes this one. Alright, moving on, results. ACA average weight loss. Ozempic's results are solid. Folks lose around 12 to 14% of body weight, roughly 14 pounds at the highest dose. Sounds great, right? But Wegovy is like, hold my protein shake. Studies show 15 to 17% weight loss, and we're talking an average of 35 pounds shed at the highest dose. Plus, it's literally engineered for weight loss. Can't argue with that, so Wegovy kinda steals the show in this category. Oh, and here's something cool and maybe a little wild. Did you know both Ozempic and Wegovy actually contain the exact same active ingredient? Yep, it's semaglutide in both, just dosed and marketed differently depending on what you need. Now let's chat FDA approval because, it actually matters to most people. Ozempic is officially approved for type 2 diabetes, helps control blood sugar, can even reduce heart risks, pretty huge, honestly. Any weight you lose is just a bonus. Wegovy, though, is purpose-built, FDA approved for chronic weight management in adults with a BMI over 30 or 27 with health complications. Both are really specialized, and honestly they both win in their own lane here. So it's a tie. So let's get into how you actually use these injection formats. Ozempic uses multi-dose prefilled pens, and I kinda love this because you get several uses out of each pen, feels less wasteful, and a little more budget-friendly if you care about packaging. Wegovy, meanwhile, goes with single-use pens. Super easy to track your dose, but if you're eco-conscious, you might cringe at all the wasted plastic. For most people, Ozempic's system just makes more sense. Now, on both sides, what are you actually putting in your body? Let's talk active ingredient. Honestly, both use good old semaglutide. Seriously, it's the same molecule. Both act on your GLP-1 receptors, improve insulin sensitivity, and are considered safe as long as you follow the dosage. There's no difference here, so we'll call this one a clean tie. Alright, side effects. This is where things get real because let's face it, nobody wants to be best friends with their bathroom. Ozempic, having a lower max dose, means nausea and vomiting are less likely or just milder. Sure, the usual GLP-1 issues can show up, but with Wegovy's higher dose, almost 34% experience some GI drama, nausea, vomiting, the works, especially at that top therapeutic dose. So for fewer stomach issues overall, Ozempic is your buddy. And let's wrap up with who each one is actually for. Ozempic is pretty much made with type 2 diabetes in mind, especially if you like the idea of some weight loss on the side. And bonus, you're way more likely to get insurance help. Wegovy says, forget diabetes, I'm all about weight loss. It's designed for those struggling pipeline to pipeline with their weight or who have obesity-linked health issues. Both have a really clear sweet spot, so let's call it a draw. So let's lay it all out visually. Imagine a radar chart mapping out cost, dosage, weight loss, FDA approvals, the nitty-gritty of how you take it, all those things with both Ozempic and Wegovy side by side. You can really see where each one stands out and where they overlap, which, yeah, is in a few places. So bottom line, if you have type 2 diabetes and wouldn't mind shedding a few pounds, Ozempic just kinda makes sense. More affordable, better chance your insurance plays nice. If weight loss is truly your North Star and you want the most powerful dose out there, Wegovy is going to give you that edge, wallet ache aside. But no matter what, neither is a magic fix, so diet, exercise, and talking to your doc still absolutely required. If you found this comparison helpful, definitely talk to your healthcare provider to see which one fits your life best. Seriously, your doctor knows your history, we're just here to decode the hype.